that to three very basic things. Obviously, the environment that we have currently going on, people seem to be more available. The other is obviously the meter dose inhaler does a phenomenal job at a time when we're experiencing more, more social stress than this country probably has ever faced. And then the other is just the leadership in the company, the decision that they've made to focus in on the objective and not let the outside influences get inside. And all of those things are contributing to what's taking place. And, we're going to continue to enhance that opportunity as we move through the month. We'll talk about that later in the call. But what I'd like to do right now, in the interest of Dr. Jasani's time, he's currently en route. Guys, he's one of the people on the front line doing everything that he possibly can to assist and help with this current pandemic, this very unusual circumstance that we're in today. And these guys are on the front line doing amazing things and literally risking their lives, right? So he's taken the time to get on the call here today and to walk us through all of the things that are, really defining the growth that we have with not only the MDI, but also our Greenway DNA relationship. So with that, Dr. Jasani, thank you so much, sir, for taking the time, and I'll turn the call over to you.
All right. Thank you, Barry. Let me just adjust my volume here, okay? All right, guys. Well, let me just start by saying I hope everyone on the call and their families are all safe and well at home. I know these are trying times, and there's a lot going on in the world. And, as Barry alluded to, I think that some of the growth, and I know some of the growth is partly due to all the anxiety and the mental stress that is put on from what we're going through as a society. And, today what I'll highlight is a little bit on what are the two products that we're most excited about right now. And I think one of them you've already heard about, which is the MDI and the meter dose inhaler, which is an absolute game changer. And I think coming on at a time like this, where there is peak amounts of psychosocial stresses and anxiety, something like that plays extremely well into society for a non-addicting anxiolytic that can pretty much work instantly. I'll also touch base on the Greenway DNA test, which is a very unique platform that we have now incorporated into the company that will allow us to get a baseline on how do we dose this for individuals, and because there's so many variables that come into play when you're dealing with a product like CBD and THC and individuals' body sizes and how they absorb things. Dosing has always been a very difficult component and a piece of the CBD and THC world that really hasn't been answered. So, when we talk about the DNA test, which is what I'll touch base on first, is that DNA technology has really scaled across the country and across the globe over the last 6 to 7 years. We use a tremendous amount of this in oncology for tumor-specific DNA mutations because we've been able to sequence and code the genome. So we know what the code is, and we know when there's mutations, the downstream proteins are not correct. And that leads to illness, and that can lead to a whole host of physiologic changes in the body. So what they've done is they've really taken the DNA technology, very similar to what Ancestry and me and many other companies off the shelf are doing, and started to apply this in a thoughtful, evidence-based way for cannabis and THC and CBD dosing. You have to understand, a lot of this is not data-driven because we don't have the data. We have it in oncology and a lot of other things, but Ancestry and me and things like that will get you data, but we don't know what to do with it. So we have to keep that in mind, and it's the very same thing when we deal with CBD and dosing via DNA platforms. And essentially, to simplify it, what they do is they look at something called SNPs. These are nucleotide polymorphisms. They are basically single DNA mutations that occur throughout all of our DNA. They're natural, and it happens because we have billions of encoded proteins, and errors are going to happen. What we've realized is that you can sequence these mutations now that we know the genome, and we can see where you have these polymorphisms. Sometimes they encode proteins that nothing happens, and sometimes they change the protein which in turn changes the effects of it in the body, and it has significant effects to the human being. So by looking at these SNPs, which is pretty much of a standard, we use it in cancer and we use it in a lot of other disease processes, they're able to compile certain mutations that are in certain people's body and then put it through an algorithm and help guide us on how we do CBD and THC dosing. And from a very big picture point of view, they will look at these SNPs for certain receptors in the body that cannabis and CBD work on. CBD1 receptor, the CB2 receptor, we know those. They're part of the ECS system. They also look at the serotonin receptor, the GABA receptor, where CBD binds to and helps you with sleep and anxiety. They look at the vanilloid receptor to see if there's mutations in that. That is where CBD binds to for pain control. And they look at a whole host of other things, such as breakdown molecules. And some of these things get pretty scientific. But really, from the big picture view, they're looking for mutations in these proteins. And by finding a mutation, hypothetically, in the serotonin receptor, it may cause that receptor to not work as well, not bind as well to serotonin, and that individual may need a higher dose or a higher amount of serotonin. This is just an example. And what they've done is they've thoughtfully gone through this, and there are about 5 other big companies that are doing this, and there is a central database and repository of all these SNPs that affect cannabis and CBD. They continue to build on this algorithm that they have and they have patented, and they add to the data, and they go to the data and they see if there's new SNPs that have been found, and they validate them, and then they incorporate them into their DNA platform, and then they come out with a report. And what you would do is you'd order the test. It's a one-time test. Your DNA is not mutating that often like that, so you can get this and use it for dosing all the way down the line, whether it's 2 years later, 5 years later. You do it once, you get the kit. It's a simple kit where you give saliva in a tube, you put it back, and you ship it right back to the company. They run the DNA from that saliva, they put it through their algorithm and give you a report. That report will be pretty comprehensive. It will be very simplistic in the beginning, and then it will go down all the way down into the individual mutations you have. And before you even do the saliva test, you do a little survey, and it asks you, what are you looking for? Are you looking for relief for insomnia? Are you looking at for anxiety? Are you looking at it for pain control? That is part of the algorithm that they put in, and then it gives you a way on how to start. If you're looking for insomnia based on your mutational burden, you would need X amount of CBD to start as a baseline. If you're looking at THC products for pain, they'll say, well, you should start with an X amount of THC to CBD ratio for this ailment. And they'll break it down based on certain ailments as well as what your mutational profile showed. We've done the test. I know I've done it. I know Barry's done it. I know Dr. Patel has done it. And it's quite interesting. And what they'll do is they will go back, and eventually they go back to these patients and they start to study. Now that you've done the test and you've started dosing like this, how is it different to somebody who's just doing dosing randomly? Because right now, CBD and THC dosing is pretty random. We don't have a lot of science on how to dose it. We know these are lipid-based compounds, and bioavailability is a big problem. Not everyone absorbs the same amount. What's exactly getting down to the receptor, we don't know. We have guesses, and we tell a lot of people start low and work their way up. But this type of test will really be able to add a little bit of science to it and get you a baseline on how to start and at what dosing to start with. So, we are excited about this. We have spent some time vetting this. We went into the technology and reviewed it. And one thing that's important as a scientist and as a physician is, and you need to be clear as brand partners, is we don't have data. We don't have clinical trials proving this, but currently we don't have anything better. We're just shooting in the dark when we're telling people start at this dose. So this is a more of a scientific way to see if we could use this data to give people a baseline on where to start for dosing. And this will add to clinical trials in the future. They do add this information to the repository, and hopefully it will build upon the science, and in future years, as this kind of advances, we're able to get more sophisticated testing with more precise and accurate data. But for now, I think the test is an exceptional way to really get a baseline using your DNA on how to get a range on what type and what dosing of CBD you need for a specific ailment. And for us, it's not going to be THC products. It's going to be CBD. Although they will give you data on the THC based on your genomics, it will really be for the CBD. And you can order it. You know, once you order it, it's very simple and very easy to do. And they will track it and they'll send you an email when you should expect the results. Now, you know, segueing into the meter dose inhaler, I think that this product is absolutely a game changer and is a very unique delivery system for CBD. There is no real similar products out there nationally or globally to this degree. And I think what we've really realized is that anxiety is pervasive. Outside of the people who have general anxiety disorder, just what we're dealing with the viral pandemic is stressful. It's stressful to us as physicians on the first line, on the front line, because we're being exposed to this at very high levels. It's stressful for our family members. It's stressful for general society. And stress is everywhere. Stress is in our patients who we take care of for very simple medical problems, all the way down to children who have anxiety disorder from peer pressure and from school and everything in between. And we're seeing dramatic rises in anxiety right now because of what we're going through. And the fact is, this is going to be an ongoing issue for the coming 12 to 18 to 24 months. So this is why things like the meter dose inhaler are extremely important, and they're part of our product line, which I do think will become the highest selling and the highest utilized and the most value added eventually. Because when you look at meter dose inhaler, what is it? It is a aerosolized form, which is proprietary and patented, of CBD with a propellant that you inhale. It is not vaporized. It is basically like an inhaler that you use for asthma. You take a deep inhalation and it goes down into the alveoli, which are the air sacs, not the upper airways, not the bronchus, but the air sacs where you exchange oxygen with the bloodstream. That is the unique part of this, because that is where 100% of the CBD that is coming out in that inhalation is getting straight into the bloodstream. And that is not being bypassed by the liver. And that is going straight to the receptors that they need to affect to give you the benefit for anxiety control, insomnia, and pain. That is why the inhaler works within seconds to minutes, and it lasts for 2 to 3+ hours. And one thing that's important is CBD, remember, I keep saying this, is a fat-based compound. Just like THC, our body cannot absorb fat-based compounds very well. We're water-soluble based creatures. So that is why you see all the nanotechnology and all of these things come into our oils and emulsification to improve the absorption of those emulsified nanoparticles when we ingest them. So our oils that we have are ingested. Certain portion is absorbed, but remember, everything absorbed in the gut goes to the liver, and it is broken down first by the liver. Then whatever's remaining, some of it is remaining, gets into your receptors and starts working. So you can begin to see that the dose you take is not the effective dose that's getting into your bloodstream and affecting your receptors. That is why dosing for CBD is so difficult. And that is why the meter dose inhaler bypasses all of that. You get an efficient use of your dosing, you get immediate effect, and it works so fast. There's no question on, did I feel it, did I not? And our oils work, and we feel it pretty well, but it takes 30 minutes. And you don't know with dosing, based on size and the other variables, on how much to take. We start low and work our way up. With the inhaler, it's very accurate, and you're efficiently utilizing it from an economics and a monetary standpoint. The people who are spending money on this, they're getting a much more higher bioavailability and efficient use of their dosing. And that's why we think that with all of this going down in society right now, a plant-based compound that does not have an addictive potential, that is an anxiolytic or works by relieving anxiety, is really important. It is no different than the person seeking out relief through meditation or through alcohol or through cannabis products. And this works. And this does not have an addictive potential. It is definitely on a different realm than benzodiazepines like Valium and Xanax, which will shut your respiratory drive down, which do have addictive potential and which do have a role in society. They probably don't have a role to be scaled across, the whole country, where we're just coming through an opiate and a benzodiazepine epidemic. So this falls really into place now as a general anxiolytic. There will be other compounds that come through that, as the company is able to get the quality of the product, such as CBN and CBG, into this meter dose inhaler. You will have one specific for pain and sleep sometimes. And the next most important thing, which to me should be the number one most, is safety and quality. So the safety and quality of this company, the way they formulated is very similar to WBRx. They built this on safety and quality first, and of course efficacy, but it has to be safe and quality has to be high, because you're ingesting or inhaling these products. No different than our WBRx products. They have traced this down to a hemp farm. They have validated that they're using the practices for cultivation. They know that the CBD isolate is made at a GMP certified facility. There is nothing else in this inhaler beside the propellant, which is an FDA approved propellant. That is very important. Propellant is what pushes the CBD aerosolized product into the lungs, and that propellant is similar to what they use in other pharmaceutical grade inhalers. The company works with big biopharma. That is their equipment. A lot of their scientists are on their team. So this is a pretty collaborative effort with a high quality company that has really put out a product that took us a little while to vet, but the company is absolutely probably the number one in the country for an MDI type of inhaler for CBD like this. And that is why we've decided to bring it on and bring it across our network. And we think that it will drive value immediately to the people who use it, our family, our friends, our other clients, etc. And this is a type of product where people will come back knocking on our door or your door, wanting more and more of this product because it works. And the safety and quality is the other part that we have kind of been able to vet and look at, and we can stand behind. So, I encourage you to try it, use it, and Barry and Sean will be able to give more information on when we get the full spectrum of products. But, we're excited for this, and I think the time is now, really, because of everything we're seeing in society and everything that's happening in the world.
Dr. Jasani, thank you so much. I really do appreciate your words. I have to tell you, one of the things that that we really have observed and watched is that people are extremely receptive, probably now more so than we would have ever anticipated, because the nature of this virus does attack the lung. But I think that people realize that it's a safe, efficacious means of being able to administer CBD directly into their bloodstream at the lowest possible cost per milligram. And I think that the amount of stress, as you mentioned in the early part of your talk, is really evident. I mean, and it's not dissipating, it's increasing as time goes on, because there's increased awareness, I think, of what's taking place. I think the things that you mentioned to me before this all erupted are becoming mainstream knowledge today, finally. And I also believe that there's a significant amount of economic stress that's being imposed with various people. So, we really do believe, as you mentioned, that, we're going to be able to host a whole smorgasbord of different types of isolate that will be concentrated within that inhaler that will be more specific to various needs, like CBG for pain or CBDN for sleep, a variety of other components within the actual plant that will prevail. And we're just excited about being first to market and doing it, as good as we possibly can. And I do agree with you. I think we're doing it currently better than anybody else is. So we're excited about that. Thank you for taking the time, sir, to be on the call. We really do appreciate it. Guys, what I want to do now is, thank you very much. What I want to do now is, we always kind of segue now to a time where we can all share our personal experiences with respect to the product. And today, to host that is my partner, Sean Baker, who's always doing a tremendous job. We've got a lot of different things going on in different pockets, throughout Texas, and also out in Salt Lake City in California. Our market share is continuing to expand right now at a time when, things are not necessarily an expansion, but we're having phenomenal success. And with that, I want to turn the call over to my partner, Sean Baker, the president of the company, and Sean can take you guys through the information required to allow us to understand how this product is working for you. So with that, sir, I'll turn it over to you, Sean.
Absolutely, Barry. Thank you, and great job, Dr. Giustani. Great to see some new faces and familiar faces on the call today. One of the things that Barry and I are always talking about is really how to keep people connected and engaged. I was listening to a Grant Cardone book. I have been for the last several days, and one of the things he talks about is selling through education, selling through information. And I had never heard his take on that or exactly how he felt about that. But as he was going through the information, I thought, man, that's what Barry and I have been trying to do for literally the last 18 years. I mean, this is a sales organization. We are try to be consummate professionals in everything we do. But at the end of the day, we are selling wellness-based consumable products to users that need the benefit of the product. And so at the end of the day, we are a sales organization, but we really differ in how we take a product to market, because one, Barry and I have never been scared to put our money where our mouth is. And I know you guys are probably just about, if not on the other side, of sick of hearing about the 6-step marketing program, but I keep beating the drum because it's so effective. I mean, when you use a product, Barry was always really good at talking about the difference between head knowledge and heart knowledge. If I read something in a book, or I have an opinion, or I express a religious view or a political view, and yours happens to differ, well, then we can either agree to disagree, or maybe I can persuade you to see it my way, or maybe you can persuade me to see it your way. But you're really talking about cerebral head knowledge, and that's one level of an understanding. But when you have used a product and you have a heart knowledge, it's either decreased your stress, or decreased your anxiety, or increased your energy, increased your focus, helped you get a better night's sleep. I mean, guys, the sleep industry, which wasn't even existent in 1988, 1989. I mean, it was a couple of $100 million as a total global industry. Last year, Ambien alone sold $88 billion because people can't sleep. And it's dangerous. I'm not saying it's not a viable product for those who need it, but there are now 67 reported deaths directly due to the use of Ambien. And so when you have a product that you can not only express and share a heart knowledge, which is step 2 of the 6-step program. So use the product, share the benefit of the product, and then give away a free sample. I mean, you have to realize how much, at least we believe in our product, because we're giving away free samples of product so that people can experience it for themselves. Now, the metered dose inhaler, I would tell you, they're going to experience in 60 to 120 seconds. I mean, 1 to 2 minutes they're going to experience. But beyond our metered dose inhaler, don't forget, guys, we've got energy tincture, a sleep tincture, a balance capsule, and a balm. And I would tell you, in order of immediacy, the metered dose inhaler you're going to experience in 1 to 2 minutes, but let's just call it 5. The balm, people have literally had experience a benefit within 5 to 10, maybe 15 minutes. So still way less than a half an hour. With the energy and the sleep, you are going to notice an effect of those in 30 to 45 minutes. And then with our balance capsule, I would just tell you, me personally, I didn't notice a benefit of the balance capsule while I was taking it. I immediately noticed the benefit when I stopped taking it. And so that one's a little bit different for everybody. I was taking the balance capsule 1 in the morning, 1 in the afternoon, didn't realize I was running low, was out of town, took my last capsule, thought, oh, no big deal, I'll get a new bottle when I get back. And let me tell you, it was a long 3 days. I've got 4 beautiful children. We were traveling, traffic, road rage, kids in one car. I mean, I missed my balance capsules. I'll just put it that way. So me sharing that benefit, there are going to be pods of people who say, yeah, me too. I don't sleep well. Barry's someone that tell you, not on this call, but if you've heard other calls, or you can ask him about it sometime. He struggled with sleep for years because he couldn't turn his overachieving brain off at night, and it would wake him up and it would trouble him. So he struggled with sleep for years. Well, now using our products, he's not struggling with sleep. He's not taking a pharmaceutical drug. I've got my own stories with non-steroidal anti-inflammatories. In the Army, they gave me these big orange 800 milligram Motrin horse pills, and you take those for pain. Well, I was popping one in the morning and one at night. They didn't tell me that the byproduct or the side effect, which is on the label, I just didn't read it, but it says right there, these products, overconsumed or consumed for a long period of time will cause, stomach ulcers. And so I have my own product testimonial. Barry's got his own product testimonial. But when you take a solid testimonial, like I'm going to ask a couple of you guys to do now, and you couple that with giving someone free product, the rest of it really does. As long as you're diligent with your follow-up, you're asking questions, you're setting up the sampling the right way, which is with two small expectations. One, Gail, if I give you a $50 sample, will you use it? That's all. And two, assuming you like one of the products or more of the products, you receive the benefit that I express that you will you simply buy one or more of the products? That's the only gamble, and that's only if it works. If Gail says, look, I tried the product, it didn't work, what do I have to say? I'm not even going to ask her for the sale. I'm going to say, thanks for trying the product. I'm sorry it didn't work. I might talk to her about a DNA test because maybe it didn't metabolize in her system, but otherwise I'm not going to hard sell her on a product that she didn't receive a benefit with. But we know the people out there, the endocannabinoid system, by and large, is the most undernourished system in all human beings in the United States today because cannabis has been illegal since the 60s. And so we now know that putting these phytocannabinoids and feeding the endocannabinoid system makes a difference. That's why people are feeling the results so quickly, is because it's a system in the body that is completely malnourished. And when you give it just a little bit of ray of sunshine, so to speak, people start to notice the effects and they start to feel better. Chance uses, and I'll let Chance to give his own story, but he calls it the shoulder drop syndrome, where you're always up tense and tight, and then you take a puff off the meter dose inhaler or you take some CBD, and he's like, literally you can just feel your shoulders drop, the tension releases, and it just kind of starts to melt away. Now, it's short-lived because we live in a very stressful, high-impact society, but that's why you can take it in the morning, you can take it in the afternoon, and keep that stress level and that anxiety at bay. So with that, Chance, are you available to come on the call and tell us your story and give us your testimony? I don't want to put you on the spot, but yeah, there you are. So I didn't mean to steal your words, but please expound. Before you do, because I know you won't tee yourself up, let me do it. Chance was a collegiate athlete with a major reputable university. Even though I grew up an Aggie fan, he was a starting quarterback at UT. We're still friends, though. We're still buddies. But he was a starting quarterback at UT, played some pro ball, has experienced a lot of pains and ailments, along with some concussions and other neurological challenges just from playing football and being a man's man. But he's in phenomenal shape. He's a phenomenal speaker. Anyone that he sits down with, he just reeks credibility, and he's one of our newest President's Partnership Club members. So with that, Chance, if you would, take it away.
Okay, yeah. So a little brief history, and Sean touched on it a little bit there. I did have a football career. For those of you in the medical world, you'll cringe when I say this, but I've had 7 diagnosed concussions. There's no telling how many I didn't. I mean, I can give you story after story where I'm sitting in a meeting the following day and coach is like, what in the world were you doing? And I'm going, I have no idea. I can't tell you because you didn't want to come out. I was a victim, for those of you that follow sports. A guy named Vince Young took my job, and that's why I didn't want to come out. He was behind me, and it didn't matter if I was seeing 3 stars or 20, I wasn't coming out. And so I developed through my own, things that I'd been through, because we're all products of our own circumstances, severe depression. I like Barry. I struggle to sleep. I'm a deep thinker. I love to read. I'm always thinking. I'm an entrepreneurial spirit. The last time I cashed a check before WBRx that my name wasn't on the front of was when I was playing football. So I've always worked for myself, done my own thing, and really struggled a lot with sleep. And it got to be an issue where I was drinking a little bit, just nightcaps, trying to get myself to fall asleep. And like anything else, you build tolerance. My dad's from Norway. My mom is Viking ancestry. So I've got it built in my DNA that I can drink quite a bit. And I was drinking, sometimes, just being honest with y'all, 2 to 3 handles of vodka a week. And it was strictly just to sleep. It wasn't going out and partying, anything like that. Made a choice that I just wanted to stop. And my stepson, of all people, told me, he said, you got to try CBD. And I said, look, I was the guy that I took drug tests for people because they knew I may drink like a fish, but I didn't do anything outside of that. It just wasn't my deal. And I was the guy that would, doing drug tests for people who couldn't pass that. And he said, it's not that. You have to understand. So I had that preconceived notion that I'm sure a lot of you will start to have to break down with people of what the plant is and what CBD is. And anyway, long story short, I got onto the CBD. It changed my life completely. I am happy. I sleep throughout the night. The products, I was a consumer of the products before I became a brand partner. I was introduced from Vincent Sinisi. We were at the LSU Texas game this year, and he said, dude, just try it. And it took me one night of using the sleep, and I said, how do I get involved? And did a little research, met Sean and Barry, and I did my own FBI, CIA background check on them, and they're just phenomenal individuals. And I cannot tell you how excited I was when they first told us about the MDI, because I knew what Balance did. I knew Balm. I take sleep. If I sleep on my shoulders because they've been dislocated, I also worked on Friday Night Lights for those of you that like TV, and separated my shoulder and my collarbone. I have issues. I put the Balm on my shoulders at night with the sleep, and I'm out all night long. It's mind-blowing how good it is. So when they came out with the MDI, I'd never used an inhaler. I was excited about it because being first to market, but truly, like Sean said, the first time I tried it, within 30 seconds, I just you felt the relax, the tension that's in your neck and in your traps and in your shoulders, it just drops, and you can focus. And that's where I think it's really a game changer, because there are people that are having stresses, and especially people that with what's going on right now, as well as there's another little niche that I've recently been involved in, and that's people with on the autism spectrum. They feel these seizures coming, and they're able to get that inhaler in their mouth and take it, and it can suppress that. I mean, it's phenomenal what this product does. And so I say that to say this: if you haven't tried it, you are going to be blown out of the water with the experience. I would tell people, when you go and you sample people, it's beautiful, because they'll be talking to you it's almost like clockwork. They sample it. They may cough a little if they're a new deal, new to it, because it is a new substance introduced into the lungs. But within like 30 seconds, they will stop you. They will stop you mid-stream and go, oh my God, I feel it. And you're like, there you go. And so it really is giving people the opportunity to try it, because like anything else, we don't know what we want if we don't know it's out there. So introducing it to people, and then their mind is blown. But it's not just the product, it's the people, it's the culture, and this whole thing. If you carry that with you when you go visit with people, and does it work? Yes. Is it safe? Yes. Will it make you money? Yes. Will it make you feel better? Absolutely. You can check all those boxes. It's a no-brainer.
Great job, Chance, and you're spot on. Sometimes we do get into a lot of the opportunity aspect of the business. We talk about the money, and Barry has said it for years, and I agree. It's always best to lead with the product. It's ideal if someone is looking for a benefit of the product and an income opportunity. But if you have to pick or choose, I'm telling you, if you lead with the product, it paves the way for the income opportunity, because if it's something they would buy or that I would buy, then in their mind, they kind of check the box. Well, if I would buy it, then others would buy it. So great job, Chance, as always. You do a wonderful job. Gail, it's coming. I'm going to kick it over to you. And if you'll unmute, or I'll unmute you if you'd like, and you're welcome to just share with us anything that you'd like. And then if Jill has had a chance to try the product, we'd love to hear from her as well, as someone new to the call, first timer. But if you've had an experience with the product that you like, we'd love to hear about it. So Gail, I'll give it to you.
Sean, thank you so much. Okay, so yes, I am here with my dear friend Jill. She's my business partner. We own a boutique together. Just real quick, I'm going to tell you guys something. So yes, Chance, like what you said is we get these samples, or depending on what level you come in, sample yourself the product so you know what it's all about, and share the product. So I literally, when I sampled the product, it worked for me immediately. And all I could think about was, I want to get this product into the hands of other people that I care about, people that I know are in the industry that care about other people and care for other people. And then I would think at night, oh my God, I just paid all this money and I'm giving all my product away. And I'm like, wait, don't think of it like that. You're not giving your product away. Thank you. You are just letting people sample the product so that you can sell it. Okay, so that's my story. It worked for me. So this is Jill. And I mentioned on the phone the other day that I had a very, very dear friend and I wanted her to sample the product because Jill, similar to me, we're probably like twin sisters. We're high anxiety, high stress. We've got our hands in about 5 million different things, it seems like sometimes. And Jill has a family and Jill has a child on the autism spectrum as well. And so I really wanted Jill to try the product and I wanted to see, she's the first person that tried it besides me trying it myself. And I'll just let Jill tell you guys. I don't even need to say another word.
So I think CBD is kind of like gas stations. There's a place on every corner. And I'm autoimmune compromised. I have lupus and Hashimoto. So I've had a chance of meeting Ethan Russo, and I'm very interested in how he prescribes and basically diagnoses and treats, because I think there's a lot of question, as the physician said earlier, just about how to treat and how to prescribe for needed. For example, I'm very high anxiety, very ADD off the charts. Adderall makes me go to sleep. So when someone says, oh, I've got CBD for high anxiety, I can take half the bottle and go for a run. On Easter, I too have 4 children and thought I was going to just orbit out of the dining room table, and Gail's like, just take a little puff off of this. Well, I also have asthma and have been asthmatic my whole life, so I'm very familiar with how to use an inhaler. And Gail's been talking about this for 2 weeks. And the minute I heard like multi-level marketing, I thought, oh gosh, here comes one of those Amway things. And I've been really polite and nice, and I've heard all about it. Well, she handed me the inhaler, and I took the inhaler, and within about 30 seconds, I just sat there and I couldn't even talk because I felt so guilty for thinking this was just another little CBD. But I mean, it takes a lot for me to be calm, and I can have a men's dose of Ambien and go for a jog. And I was literally the most calm, cool, collect. I didn't want to kill children. And my first thought, honestly, was, and I do a lot of philanthropy work for autism, and my other children are very, very high IQ, high ADD, high stress, but extremely intelligent. But there's a big curve between being able to concentrate and actually work and being so ADD that it's actually handicapping you. And so my first thought was, oh my gosh, as I looked over at my 8-year-old who is very high functioning autism, how can I get this into his body immediately? Because I'm so sick of having psychiatrists try and prescribe things like Seroquel, because it's, you know, an anti-seizure medication that's supposed to calmly affect them. And I loved what I believe Barry said earlier, which is, oh, it takes 30 minutes to work. Well, an autistic mother, when a child's about to have a breakdown, doesn't have 30 minutes. So right. I just, again, I love the product. I think Gail's right on. I'm actually going to sign up with the company. I was so excited. I didn't know what to do except take another puff about an hour later. But you know, I tried it 3 times. I did try it before bed last night, and I have never in my life that I can remember slept through the night. And I just slept like a baby. No wine, no anything. Just took that.
She transformed before my eyes, and I've known her for a very, very, very long time. And I just looked at her and I'm like, who are you? You actually, you cooked a ham without burning it.
And you're calm. It really did work in about 30 seconds. And I am high anxiety, high ADD. I mean, I can do 7 things at a time and start up 6 businesses in my head before sleep. And I mean, it just really calmed me down and worked. I mean, really worked. And I can say I've tried so many CBD products that just, as well as THC products from California, my physician will prescribe, and I know we're not really allowed to do that, but we do for my autoimmune, and I take different types to test through Russo, and some things work and some things don't, but I can tell you that based on everything I've tried, this was like night and day.
Nice.
I just want to know how to get it into my children.
That was one of her questions is, you know, the inhaler, I don't really know how that works with children, or if it's even, I don't know. Tell us about that, because that's her.
Yeah, so great job, both of you. I'll mute your line just for background noise, but great job, both of you. And Jill, welcome. We're glad to have you aboard. We're glad you received great benefits with the product. And Gail, we've been excited about you since the minute that we met you virtually, and can't wait to meet you in person. And I know there's great things ahead of you. And if you guys are going to do something together, I say watch out, everybody, because it's going to gonna be trouble. Two redheads running around kicking everybody's butt. I think is a great 2020 plan. So that being said, so the meter dose inhaler, Chance said on the call just the other day, if you take our meter dose inhaler in a white napkin or paper towel and you hold it up and you spray it, you'll see that it leaves no dark residue. It's completely clear. I mean, obviously it gets the paper wet because it is expelling a product, but it's clear, it's pure, it's clean. I give it to my children. My children actually, so I've got a 23-year-old son who's been married since last October and is buying his first home. And I swear he must eat a bottle of balance capsules, every 2 or 3 weeks. And then now he's using the inhaler. But I've also got a 20-year-old daughter, a 15-and-a-half-year-old daughter. I got to throw that half in there because she's about to get her license. 15-and-a-half-year-old daughter and a 13-year-old daughter. Well, 2 of my 3 children have been diagnosed with ADD or ADHD, and one of them is actually on the Asperger's scale. And so this product, and I feel bad as a father and as a parent that I didn't have this product, 10 years ago when they were younger, when they were growing up. I just didn't know. And I would tell you, much like what you said, Gail, about Jill, I have watched them transform right in front of my eyes. And as a businessman, I'm excited, don't get me wrong, but as a father, it just absolutely melts my heart to see my children, excelling and achieving a level that they never had prior. So yes, I say you can absolutely give our products to your children. Now read the disclaimer on our website or in the box about the balance capsule, because that is a full spectrum product. So just read that disclaimer so that you know all of the do's and the don'ts, if you will. But all of the other products are children safe. Yes, ma'am. Gail.
I have one other comment. While Gail was at the house, we decided to just let the whole family try the CBD. But my son Connor is 15 years old, and he was an avid football player and offensive lineman. And 2 years ago, he suffered a massive concussion. It took him 12 months to get over it. And he's had horrible headaches since then. And he actually tried the product, and that was the first 6 hours he's gone since then, where he said, "Gosh, Mom, I don't have a headache." And we were just all blown away.
Well, my 2 cents on that too is take the balm and rub it on the back of his neck, and rub the balm on his temples. Again, this is not a medical claim. We can't say this, but what I'm just telling you the testimonials I've received. Personally, it has helped me with headaches and sinus and just pressure. But people that I'm talking about are migraine sufferers say that if they even kind of feel a migraine coming on, they'll do the balm on their temples and on the back of their neck, and most cases, the migraine never even shows up. And in the event it does, it's considerably more mild than anything that they can take prescriptively or over the counter. So with that, Art, I want to kick it over to you to close us out. Now, Art is from a genealogical perspective. Art, as a result of Michael Vandiver, who is a new PPC member, as is Mitchell Holzer, is a new PPC member. But Art's come on with a fury. He's got a great heart. He's got almost 8,000 LinkedIn contacts. So he's out pressing the flesh, talking to shops, talking to people. And he's also utilizing those 8,000 contacts within LinkedIn to really expose his opportunity for both the product and the business side. And then he's already brought on Hunter and Bryce. And so they've just got a great little organization building there, a little feeding frenzy of activity. But Art, it's 3:45. So why don't you give us 2 to 5 minutes here of your story and your benefit of the product, and then we'll kick it back over to Barry to close us out with some words of encouragement. So go ahead, Art.
Thanks, Sean. Can you hear me? Perfect. Thank you so much. And man, it's great to listen to Gail and Jill share their story. I got excited, and if I hadn't signed up, I would have signed up after their testimony. That's for sure. And then hearing Chance share, man, I have a lot of respect for him and everything that he's doing with the company, but also personally, the experience he's already had with the products and how he's sharing it. There's just, I hadn't thought about that market of autism and ADH and stuff like that. So that's some great ideas. Just real quickly, my background was, has been in the medical device industry for a little over 30 years. And I've had a great ride in it. I was able to start a company as a distributor. In over 12 years, we grew it to roughly 15 million. had 17 1099 reps. We covered Houston, San Antonio, and Austin. And that was a great experience. That ride slowed down significantly a few years ago. And I was approached by Michael probably middle of last year. He was talking about you guys, and he met y'all, what great leaders you are, and the products that you had. And at the time, I wasn't real receptive, to be honest. I tried some direct sales opportunities, and I had failed miserably at them. I had some bias, and not in a positive way. But what changed everything for me was when I met Barry at his office with Michael, and he let me sample the product. I was just like the others said, within a minute, maybe less, I started feeling a calming experience. And as time went on, I noticed that my mental clarity was so much better, and my focus was so much better. And this subtle energy that I don't think I've ever experienced before. I've tried different energy products like 5-hour energy and things like that, and I didn't like those. I didn't like the way they made me feel. So I didn't use those. But it's hard to describe, but the best way I can paint a visual picture is I look up at the clock, and it's 2 to 3 hours later, and I've done a whole bunch of stuff, and the time just flew by. And I found myself a whole lot more productive. Now, I love the transparency on the call, and I want to also be transparent on the call in terms of what I found to be the biggest benefit for me personally in using this inhaler. I've been on 2 really strong medications for over 10, 12 years. One was for anxiety, and another one was to block my opiate receptors. I'd had a real bad problem with pain pills years ago. And I've been on those medications, like I said, for 12 years. And one of the reasons I wanted to get involved and really try this product was to see what impact it would have on me in using those products. Could I taper off of them and not experience the horrible side effects and withdrawals that they have? Because I've tried before, Sean, a couple of times just to quit cold turkey, and I could not tolerate that. One time I even had to be hospitalized. Since I've started, I've gone from using 1 clonazepam twice a day. I'm down to a half on the nights I take it. I don't even take it every night anymore. And then on my Suboxone, I was taking 1 8 milligram, which is the strongest strength they make, twice a day. I'm now down to half twice a day, and this is when the last 3 weeks, and what I'm not experienced is the withdrawals of those medications, and both of them are very, very uncomfortable withdrawal side effects. I'm amazed right now. And it's answered prayer for me. I don't want to have anything in my life that controls me, that I have to depend on. Besides God, I'm all there. I'm good on that, definitely. And I do depend on him. But and right now I'm just using the inhaler. I ran out of my balance capsules, so I got to get some more, but the inhaler alone is working, and I use it probably 3 times a day. So man, I've got a testimony with these products that I know comes from my heart, and I can share that with others. I've shared it with a guy who has a lot of experience in the CBD industry, owns a couple of franchise shops here in Houston, is also on the board of a co-op of 22 stores here in Houston. And once he tried it, his business wheels started spinning just while we were talking the first time of things that he wanted to do with this. And before I know it, he's talking with the founder of the company. And I got an email yesterday saying the founder wants all the info he can get on our inhaler. and they've got 2,200 shops across the country. So that's exciting. You know, it's going to take some time. That's cool. You know, whatever time it takes, it'll be worth it. I've got some other people that are also in the CBD industry that are either waiting to get a sample or they are evaluating the business opportunity. And it all started with sharing taking the product, sharing the benefits, and then sampling. And that's what I've been, that's what you and Barry have done for me, is shown me the system that worked for you and have been teaching it to me. And I'm just trying it each day to get better at it. These calls are extremely valuable for that. The Saturday call is very valuable. The Monday morning wake-up call is very valuable. Hearing our other people on the call talk, they all contribute to my education. And I think that's what's going to make me successful at this. And I hope I can contribute to some other people's success. So hopefully that's good for now, Sean, and I really appreciate you giving me a minute to share.
Great job, Art, and thank you for sharing so transparently and so openly. It's not something you guys have to do, and these calls aren't scripted, but it just means a lot. There are a lot of people out there suffering from a lot of different things, and just since you brought opioids out, you know, I don't like to talk about it too much, but if you get into statistics and you start reading, it's not hard to find, but there are 1,500 people per day that die from opioid abuse, opioid addiction. And that doesn't include the folks that essentially ruin their life, their family, their finances, they lose a business. I mean, there's just a number of different things that's going on. And I know we're in a pandemic for a virus, but there is an epidemic going on in our pharmaceutical community, and it's being driven by big pharma. And Barry and I are not anti-pharma guys. We're not people that if I have a headache, I'll pop a Tylenol if I have to, or if I went to the doctor. I mean, I took pain pills when I had my wisdom teeth pulled out, and believe you me, they pulled all 4 of my wisdom teeth, and I used every pill in that bottle, you know, like I was told to. And then when I was out, I was out. So, I mean, we're not anti-pharma, but we are anti-brainwashing, and we're anti, sheep herding and just being thoughtless and careless about our overall health and wellness. So, Art, I commend you for your honesty and your transparency. I've spent enough time with you now on the phone and these phone calls. I do know that there are many, many blessings available and ready for you in the not too distant future. So keep doing what you're doing, and we're proud to have you as a part of the team. So, guys, with that, it's 3:55. I'm going to kick it back over to Barry just for some positive words and departure and encouragement. Barry, not unlike you, Jill, I stood my best friend up for 5 or 6 meetings that he invited me to. Some I said I couldn't go. Some I said I would go and didn't go. I mean, the reality for me was I was down on what I wasn't up on. I didn't understand, and I thought all multi-levels were like Amway, and I was going to be selling my friends and unable to move my product and all the horror stories you heard. But finally, unfortunately, he didn't give up on me. He got me to go to a meeting where I met my now business partner, Barry Koshu. And I'll tell you, more than anything, I love the products. I love the opportunity. I love the lifestyle. But more than anything, I'm a person, I like to lead, but to be a leader, you have to be surrounded by leaders. And I don't like a lot of talk. I don't like a lot of leadership talk. I like to look at the fruits of the tree. And Barry was someone that now has done almost $500 million in sales in the network marketing direct sales industry. He's helped over 500 people earn a 6-figure annual income, and over 50 people, and myself included, I'm in this number, earn a 7-figure income in the network marketing direct sales space. I had never even been involved in the industry. I didn't know anyone who had I don't think I knew anyone that had made any money. I think pretty much everyone I knew got involved, bought some product, maybe moved their product and more or less broke even, and then they were out of the industry. And you guys need to know that is an industry statistic that we battle and that we face, but we do things so differently. We are literally changing the face of the network marketing direct sales industry. And it's more than a career. It is a passion. It is an opportunity for us to make our mark on the world well after we're gone. And that's what Barry and I get up and strive to do every day. So, partner, thank you for being up at 5 o'clock in the morning and taking calls at 10 o'clock at night. Thank you for continuing to do what you do. And I'll let you close us out with a few words of encouragement. Hey, Barry, you got to unmute, buddy. Sorry.
Okay, can you hear me? Okay, great. Well, let me go back and say, great job, brother. As always, you do a phenomenal job with these calls, and it's great for me to be able to just sit back and listen to the new people. I know that Jill, welcome. So glad to have you. And Gail, as always, great job. Chance, fantastic job as you always do. And also Art, man, you guys are really, I think you're doing a phenomenal job of communicating, conveying, what this product is really meant for you. And I think that's going to open the doors for you with respect to other people. And guys, we're now coming into a time where, we're having these calls on a daily basis. We're having a phenomenal amount of attention that's garnered, not just from the call itself, but also the recording of the call that we make available to a lot of people. And I think that now, as we start to move forward, I think that you're going to see it. We all know and believe that there is daylight at the end of the tunnel, and there's going to be a moment here before too long when we are no longer asked to be in isolation, when we can actually sit amongst each other and start sharing and talking with one another. I was telling some folks the other day that there is nothing like the exchange of energy when people are together. And all of this has happened, guys, from where we started in this pre-launch campaign back in March to where we are today, without us being able to really be together. I mean, we haven't been able to conduct this business in the fashion that it's capable of being conducted. We've had to reschedule 2 different events, and guys, we're just humming along. And I just want to encourage you with the reality of knowing that when we come out of this time and we're able to sit together and we're able to fellowship and we're able to spend time socially, when we're able to convey to people in real time, in the presence of what's taking place with people that have suffered drastically from social anxiety, from people that have suffered economically, but they made a decision to do something about it. I think that it was mentioned that Michael is striving to get to the PPC rank by the end of the month. That's Art's sponsor, and Michael was sponsored by a guy by the name of Jay Comax, and Jay was sponsored by a guy, Brett Shoemaker. They're friends of ours, but they're MIA. But you guys are driving the business, and you're creating more growth because of the amount of exposures. And I'll just conclude with this last bit of encouragement, guys. This business is incredibly simple. Okay, I didn't say it was easy. I said it's very simple. It's really just a function of doing the very same things consistently over and over and over again. And I know for some people, the discipline required to do that is sometimes a challenge. It's not hard. In fact, the more you do it, the better you get. I would tell you that, Sean Baker's not the same guy that he was 20 years ago when I met him at all. But because of the repetition, because of the amount of time and energy and discipline that he spent continuing to share information, his vocabulary, the amount of information he has to offer, it's way different than it used to be. And all that's true. Many of you came into the game with a high skill set. Chance, your skill set's way, 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 way better than mine ever was when I got involved in 1992. I mean, the first meeting I did, I promise you, if I wasn't doing the meeting, I would have left. It was horrible, right? So you guys come into this thing so different. And I'm just listening to Jill. I'm listening to, just the articulation, the ability to communicate. And that's a big part of this. And at any particular time, I've always told people, if you ever want to know if someone should get involved with you, just sit on the other side of the table and ask yourself that question. Would you get involved with yourself? If you listen to the information, the words you convey, and guys, we're on the brink of something I believe is going to be significant as we turn the corner. I think that you're going to find a lot of people that are going to want to get involved within WBRx because you guys are leading the way, and we're fortunate enough to be a part of it. We want to do the very best that we can to create as much of a support system and as much of a platform as we possibly can for our leaders. That's our goal. Sean and I really want to put together a unique platform. We're in the process now of talking about a virtual platform that will allow us to continue to advance and grow for many, many months and years to come as a result of what's happened. So it's all about taking sometimes a crooked stick and hitting a straight lick. It's all about taking what maybe was meant for bad and turning it into something remarkable for good. And all of us have that unique opportunity. The first place to go with that is in our hearts and our minds, and then we can certainly adjust and make that a reality for ourselves and for our families and for other people. So with that, I'm excited, guys. We've got a lot of things going on. Tomorrow we'll be here again at 3 o'clock, and we'll be communicating more information. I want to invite you to actually bring some new people to listen to the call. Gail, great job. And I think that all of us, sometimes these Zoom calls need us, and sometimes, we need the Zoom call. It just depends, right? We used to say that with regard to meetings, but for now it's a virtual meeting. And very soon, guys, we'll get on the other side of this. We'll be able to meet together. I think Sean and I were talking about planning a social event. He's going to come to my house and he's going to cook, and we're all going to be able to hang out and have a good time out at the pool and just socialize over at the house, So we're going to have a good time, guys. We're thankful that you're part of what we're doing. We're thankful to be part of what you're doing and to be able to collaborate and build something significant. So with that, thank you so much. God bless. We're finished. And Sean, thank you, brother. Appreciate all that you do, man.
Thank you. Great job, guys. Have a great week. See you tomorrow.